Okay, thank you so much. Well, ladies and gentlemen, because our esteemed speaker already been uh, here with us, so would like to start our agenda. Good afternoon, distinguished guests, delegates, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Thank you so much for attending the second plenary session of this event, especially to our esteemed speakers, participants, and all guests who are joining us virtually. We appreciate your continued presence at this event. This second plenary session will be moderated by me. So before we keep on to the main agenda, let me introduce our respected speaker. Along with us, Dr. Sharibah Nurris, Cardiff University, United Kingdom. Doctor, welcome to Latan Samasira University. Well, ladies and gentlemen, without further ado, would like to invite Dr. Saribah Nurwitz from Cardiff University to present her material in regard with estimating emergency ambulance demand in Jakarta, Indonesia. Please, Doctor, Doctor, can you hear my voice? Dr. Sari, can you hear my voice? Dr. Sari, are you with us? Mm-mm. Dr. Sari, can you hear my voice? Can you hear my voice? Dr. Sari, we can't hear your voice. We apologize because we can't hear your voice. Dr. Sari, can you hear my voice? Sorry, doctor, for waiting. We would like to invite the IT to switch on your microphone. Okay,
Hello, Tess.
okay.
Can you hear me now?
Okay, I can hear. I can hear you.
Thank you. Thank you very much.
Yes,
So is it starting now?
yes.
Okay. Good afternoon, everyone. Greeting from United Kingdom. Still morning here. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Wabarakatuh.
Waalaikumsalam warahmatullahi
Sorry for the delay.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you.
Waalaikumsalam
And Ibu Bu Uis, yeah, would you like me to share my screen directly or?
While you are waiting for displaying your screen.
So are you displaying my screen or?
Yes, we are trying to display your screen. Wait a minute. We do apologize for Dr. Saribris.
It's okay. It's okay. So let me just.
Good afternoon, Dr. Sardi.
Good afternoon. So would you like me to share my screen instead or?
Yes. Ya, di-share aja dong, Pak. Materinya mau balik aja. Okay, what about this, doctor? Have you seen the screen?
Yes, I do.
Is that
This
your
is your screen,
screen?
right? This is your screen or this is my screen?
Yes.
Okay.
So would you
Let
like
me just.
to display by your own?
It's okay. Okay, I'll speak about okay. Can you use the display setting or okay.
Okay, okay, okay.
Okay, that's fine. That's fine. If you can't do it, that's fine. So yeah, hello everyone once again. I'm Sari Bryce. So my full name is Sharibah Nur Bryce, but I'm here known as Sari Bryce. I work at Cardiff University, and today I will be presenting one of our collaborative works where we applied aircraft modeling techniques in emergency ambulance services in Jakarta, Indonesia. Before I get to that, I'd like to tell you a little bit about my groups. Can you move down
Yes,
slide?
yes,
Okay.
this one.
This is one of the main building of Cardiff University. Cardiff University is one of Russell Group in the UK. Can you move down the slide?
Yes.
And I work in the School of Mathematics, and we have several research groups. My group is under operational research, and we just moved into a new building called Abacus Building, and we are situated in Cardiff. Cardiff is capital city of Wales, one of the country of the United Kingdom. And then our focus in research is in planning and optimization, also queuing systems and healthcare modeling, also environmental modeling, and also we have people focus on finance and risk. Can you move down? In early 2020, can you move the slide, please? In early 2020, or precisely end of 2000, before previously, okay, before 2000, sorry, end of 2019, we conducted a collaborative work where we collaborate with different institutions in Indonesia, in America, and also in Wales. Can you move down? And some of our collaborators, they are trauma surgeons, nurse paramedics. We also have mathematical modelers like myself, and we also have directors and emergency ambulance service providers. Um, can you move down again? Before that, I think. You move it too quick. No, before that. No, no, no. It's before that. One more? Before that? Okay. Okay, sorry. Okay, okay. This one is maybe you have heard the name of AGD 118. Their base is in South Tangerang, but they operate across Jakarta as well. This is one of private ambulance service in Indonesia that I know. Professor Aryo, the one in the middle, he's a trauma surgeon. He's one of the founder of emergency medical service in Indonesia, I believe, in 1970s. And this is their headquarter when I first visited them to ask them to kind of like collaborate with us. Can you move the slide? And another partner is the ambulance service providers that is funded by the government. Okay, I move. Okay, maybe I can just share my screen if you don't mind. Is that okay? Are you okay? Let me just share my screen, yeah?
Yes. So you
Okay.
can share by your own selves.
Okay,
Doctor.
that's good.
Okay. Thank you.
So where we are now. Okay, also then, okay, this one. Is it this one? Yeah. So this is actually the government funded emergency service. Now I think they now changed name to PK PK3D, if I'm not mistaken. Pusat Krisis uh, Pusat Krisis dan Kegawat Daruratan Kesehatan Masyarakat. They are in Jakarta. And we also collaborated with Welsh Ambulance Service, NHS Trust in Wales, and two staffs from ambulance service in Tangerang. They came across to see us, and they get like see how ambulance service operated. I'm not an expert in ambulance service because I'm not a nurse paramedic, but you know, this is one of the highlights of our research collaboration. Then we not just modeling using mathematical model, but we also try to connect between services so they learn one another. Uh, then you may ask questions why we are interested in emergency medical service at all. You may have heard people who probably interested in this kind of work that's around the globe, in particular in the developing countries. Emergency medical service are still, under pressure. Uh, One way or another, especially in the developing country, that issue that we face may relate to funding, lack of funding, and this is can also leads to inadequate equipments, vehicles, infrastructures, and also lack of trained paramedics. Um, Not to mention that organizational factors such as too much bureaucracy, which can delay the ambulance response time. And also, one of other factor is lack of public awareness about the ambulance itself. Then we found the gaps also in understanding how the demand pattern evolves, how service provider can actually provide the service effectively or adapt to the changings of the populations. For example, uh, our project itself is part of a bigger project. It is called Modeling Emergency Medical Service in Indonesia, and it is funded by EPSRC through their Global Challenge Research Fund. The project itself is divided into several work package, and today that I am going to talk to you just two of the work package. The first one is regarding the survey, information gathering, and data collections. And the second one is about simulation modeling for demand estimations. All of this has been completed and several publications already published and one way on the go as well. So the first one is regarding information gathering and data collections. We may aware that in healthcare modeling, we rely on uh, data. However, we realize that a comprehensive aggregated data may not be available or easily available obtained for one reason or another. So we started our project by conducting a large survey in Jakarta. So we consulted several hospitals. However, information gatherings also, uh, by the times we pass or we conduct the survey, we also liaise with other stakeholders, which we mentioned earlier, 118 and 119, where we can get information regarding the utilizations of the ambulance in Jakarta. We also consulted other data sources such as those from Statistic Office in Indonesia, BPS, and also, of course, literatures. However, there's not many published literature that can be accessed internationally regarding emergency medical service utilization or emergency medical service in general in Indonesia. And also, we gather from our partners some of administrative data. Administrator is the one that they collected day to day, as the ambulance is used. So with the survey, what we did is we collaborate with several hospitals in Jakarta. Uh, we survey those patients who attended the emergency department, um, uh, regardless of the time and regardless of the method of transport they use. So we collected several variables, and the first one that we looked at is the transportations. How did people or how did the patients go to the hospitals, for example? And we collected some people's, majority of them, in fact, they went to the hospital in the emergency situation using their own car, and also they use ride shared service car. This is maybe you call it like go car or what is another one or something like that. And then some of them use public transport, and only under 10% people go to the hospital in the emergency situation using ambulance. Although we know not all people going to emergency department they need ambulance, but considering that this is actually emergency departments, it's only under 10% is quite yeah. So we mapped out where did they come from, people who use ambulance, where did they come from, or their own car, or, motorcycle, in fact. A comprehensive report has been published. If you are interested to read more, you can consult this journal. You can see a comprehensive report on the survey. Uh, the other thing that we collect also is the patient's medical conditions. So we are interested onto finding out how these people go to the hospital and what condition they actually have, or experience. So we mentioned earlier, under 10% people went to the hospital using ambulance. And what's sad is the majority of trauma patients, they didn't use ambulance. In fact, only 10% that us use ambulance. And then in Jakarta in particular, at the time of our survey, the ambulance came as a third or fourth choice of transfer to hospital. This is quite sad actually. Uh, then we look as well on the why didn't people use the ambulance to go to the hospital? What is the reason? The first one is that majority of people didn't know how to contact ambulance. Um, the thing is, some of these people who didn't know contact ambulance, but also they ended up using ambulance because they get helps from their family members or from significant others. And when we ask the reason, we ask patient why they didn't use ambulance. Um, the reason varies, and some of them noted, like almost 38%, that they were not aware that ambulance service is actually available, and then they didn't know how to contact ambulance, and then also they perceived severity mean they think that they are conditions, they don't need ambulance, which is probably true for some cases. um, the things that is actually we found that for those people who try to contact ambulance, only 12%, around 12%, they said that the ambulance not available. So they tried to contact ambulance, but the ambulance not available. It means that the ambulance busy for some reason. The ambulance busy, and there is no enough ambulance that may indicate. Another one is that um, they said that it's quite expensive, and this is true. For some people, they may have to pay ambulance. Free ambulance may not be available across Indonesia. Only in Jakarta, through 119, they can have a free ambulance. And another reason is that they said that ambulance took too long. This is considered concerning the response time of the ambulance. And indeed, when we analyze the response time, ambulance median response time is higher than any other methods of transport. Now, you may ask, what we do with the survey results. So from the survey, we get very important informations regarding the time of when people calling for the ambulance, and we can map that in any day in a week, so we get the distribution, so when they are actually peak time, when they are busy, when they need more, you know compared to other time. And also another information that we get is that where did the patient come from? So we know that from the survey, patient can come from one of the neighborhoods in Indonesia, in Jakarta. So if I'm not mistaken, there are about 261 neighborhoods or kelurahan, yeah, you call it kelurahan in Jakarta. That's only in the mainland. We know that there's another around six on a Thousand Island, if I'm not mistaken. However, we only use the data from the main line because we didn't get patient coming from the Thousand Island. And then we use these two informations to kind of like estimate on the ambulance or emergency medical service utilizations across Jakarta. So, so the next section is, which is estimating the ambulance need. Our objective is to find out the annual volumes of hospital emergency visit. This is relating to ED visits, emergency department visit, and the corresponding demand for the ambulance services across city of Jakarta. Um, So this is our aims, our objective for the modeling. And then what we do is we realize because we didn't have aggregated collected data that we can get from ambulance providers, either it is from the private or the for government funded. So we use several data sources. The first one that we use is our survey data. From the data, we know where the patient came from, we know whether they use ambulance or not, and we know what time they call for an ambulance or what time they go to the hospital. And another source of data, we consulted the National Statistic Office report, and they give us information on the size of the population across Jakarta, in fact, for individual neighborhoods. And also we can get the information on the commuters' behavior as well. Well, we talk a little bit later. And then another one that we need is we need to sample data from ED hospital across Jakarta. So this one is different from our survey. This is more like aggregated survey where we need information, the annual total number of people going to the hospital for year 2019. Okay, so our aim is to get estimations for each individual of neighborhoods here in Jakarta. How many people go to the hospital? How many people go to the hospital using ambulance and so on. So for the model, the mathematical description is very simple, but the actual simulation is quite not simple because of the parameter. What we need is the population size per neighborhood. So this is per individual kelurahan. We need the total number of people during daytime and nighttime. Uh, why we divide it? Because we want to know uh, the estimation for the nighttime and the daytime. And we are lucky, we got information from BPS, the statistical office, regarding the commuter behavior. We know that's people from outside Jakarta boundary, for example, South Tangerang. They went to Jakarta to work or to school, and also people from Jakarta, they went outside Jakarta, outside boundary to work and to go to school, for example. And then we take the net volume, the net numbers of these two populations. And the next parameter that we need is the probability of an emergency happening during daytime and nighttime. In this case, we just simply divided the day into two daytime and nighttime. And also, we need the expected annual rate of ED visit per capita in neighborhood. Another one is we need the proportion of ED from neighborhood that arrive using ambulance. To model this, what's why is it there is this? Okay. Okay, we move on. So population estimate, for the first one, population estimate during daytime and nighttime. As I mentioned, we get it from the statistical office, and we see here, we get the net commuter. And then for the constant, this is what we use for parameterizing our models. And then from this information, we can get estimates that on the daytime, the total population in Jakarta around 11.6 millions at that time, and for the night times is given by the BPS 10.5 millions. The next one is that the probability of calling for ambulance, as I mentioned, from the whole survey data, we can estimate when did people call for ambulance. So we get the proportion calling happening in the daytime. It is 0.6 to 5, and the proportion of callings happening in the nighttime is 0.375. From this, we also get the surveys mentioned. We survey another 10 hospitals across Jakarta to find out the volumes of people attending their emergency department, and we get the statistical estimations. And our aim is to find out the annual rate of ED visit per capita, which is this one at the bottom here, 0.1, the median 0.2 and 0.29. If I'm not mistaken, this is pretty much around the estimations of utilization of ambulance for developing country. Um, this is just a description for the model that we built. Nothing fancy here. This is just to tell you how the naive model and weighted naive is formalized mathematically. So basically what we say here is just we take the average. X is the number of people per individual neighborhood that use ambulance, and y here is the number of people not using ambulance, and that z is the total number of people that attending the hospital. So for the Monte Carlo simulation, we use this to generate large numbers of sample for people using ambulance and not using ambulance for each individual neighborhood or kelurahan in Jakarta. Again, the use of Monte Carlo simulation is to see whether there is any variations in the number of people, that attend the hospital. So again, X is the number of people using ambulance, and Y is number of people who doesn't use ambulance or didn't use ambulance. Okay, I might have speed here a little bit. So we ran a lot of simulations, numbers, and over I think 500. And then we take a statistic out of it. This is just a simplification of the statistics, and we get the estimation, perhaps you may call it crude estimations, about the number of people attending the emergency departments during a year, between 900,000 to 2.6 millions. And I think we found another literature that estimates the number of people attending emergency department in Jakarta, but using a different method. And I think they estimated around 2 million people. And our estimation is slightly higher because we use a different methods, and also the population dense already changed. There's increasing populations and such and such. So then, using the result from the simulation, we can then plot where these people comes from. So you can see which area that have a lot of people going into the hospital, and so on and so on. We can see that the red marks, I'm not mistaken, is the where the ambulance post there are, and the black one, I think, the hospital. So you can see where there is a darker color is the more people than the lighter color. So in summary, um, here I have shared with you how Monte Carlo simulation was used to estimate the annual demand of ambulance services in Jakarta. And the model incorporating spatial, temporal, and population factors, and the result indicated a relatively high demand for emergency and ambulance services across the city of Jakarta. And I think this highlights probably relevant to the ambulance provider, whether people who call for their ambulance is already matched this, or at least they know how much or how many people actually using the service. So the thing is, due to the lack of comprehensive and aggregated data, so we need to consult different sources of data, and this might affect of the accuracy of the estimations. However, these findings highlight the pressing needs for a systematic aggregated data collection that support evidence-based planning and emergency ambulance service. For this method, we also have published. If you are interested to look at what we did, feel free to read that. I think that is for today. Sorry. Okay. So, Bu Uis, I think that's my talk today. If you have any questions, yeah.
Okay, thank you so much for the such insightful material from Dr. Rees. Okay, ladies and gentlemen, if I can create a summary, Dr. Rees telling about the emergency of medical services, especially for the ambulance, yeah. And it's actually related to our conditions right now, Dr. Risk. If you can see the situation and conditions in our hospital, especially for our rural area, many people don't use the ambulance because of that. You have already explained before, lack of funding or maybe inadequate vehicle equipment, lack of trained paramedic, or lack of public awareness. And it is a very important and interesting materials, yeah, because it is such a real situation and condition that actually happen in our rural area, not only in Jakarta, but your research conducted in Jakarta. But what about in rural area? Yeah, in Jakarta also, yes, our big city. The demand for ambulance is lack. So what about in rural areas? Okay, it's such an interesting material, yeah, especially for the ambulance demands, ladies and gentlemen. Uh, Dr. Chris also in her research tell us about some reasons, yeah, why people don't use the ambulance, and also how the conditions about the transport and medical condition in each hospital that you have already visited, Doctor. Yeah, and this is the real situation in Jakarta, and also actually it happened in rural areas. Yeah. Okay, thank you so much for such an inspiring material, ladies and gentlemen. Okay, we would like to open the floor for any questions. Does anyone have something to be asked or discuss or comment related to our material today? Please. Yeah. Any one of you? Jadi Bapak Ibu ya sedikit can I translate by Indonesia Dr. Brice ya to
Sure.
make it clear ya. Ladies and gentlemen, jadi Bapak Ibu sekalian apa yang sudah disampaikan oleh Dr. Brice ini berkaitan dengan demand, di mana demand ini ada berkaitan dengan ambulans ya, penggunaan ambulans yang terjadi di Jakarta. Berdasarkan hasil penelitian daripada Dr. Bliss ini, ternyata ambulans tidak begitu banyak ya digunakan oleh para pasien ya, karena sejatinya ada beberapa banyak kendala ya, apakah itu dari kurangnya eh, apa namanya persiap alat-alat yang diadakan oleh rumah sakit atau juga kurangnya paramedis dan juga ada public awareness, artinya masyarakat ini tidak begitu sadar tentang pentingnya ambulans ya, dan apa mungkin juga masyarakat juga tidak tahu kemana mereka harus memanggil ambulans begitu ya. Jadi penelitian ini menurut saya sangat menarik ya, karena tidak hanya terjadi di kota besar saja, tetapi juga sebenarnya Bapak Ibu mungkin mengalami ya ketika ke rumah sakit tidak langsung panggil ambulan begitu Bapak Ibu ya. Pasti menggunakan your own vehicle ya, motor atau mobil atau mungkin juga go-kart begitu ya Ibu Dr. Sari ya. Use the public transportations begitu ya. Jadi Bapak Ibu silahkan jika ada yang mau bertanya terkait dengan apa namanya berkaitan dengan kenapa sih gitu ambulans ini ternyata tidak digunakan sebagaimana mestinya begitu kan, bagi kenapa orang-orang bisa tidak tahu begitu kemana mereka harus memanggil ambulans. Anyone hope you want to ask the questions? Ada yang mau ditanyakan Bapak Ibu, silahkan. Ini sangat menarik ya, khususnya untuk mahasiswa dari kesehatan begitu ya. Jangan sedang kan. Any one of you? Silakan Bapak Ibu untuk bertanya terkait dengan eh, demands of ambulance ya khususnya di Indonesia ini gitu. Ada yang mungkin pernah berpengalaman sehingga berbagi pengalaman ya. Maybe anyone of you want to share your experience ya, Dr. Saris May ya. If you have an experience related to ambulance, you may share with us, and then Dr. Sari maybe will give you such suggestion. Any one of you want to ask, especially for health faculty dari Fakultas Kesehatan? Any one of you? Please raise your hands.
If it is it's okay for me to say something.
Okay,
Bu
okay.
Nurul, I think what you said is quite interesting too. So we didn't just do research in Jakarta, but we also
I see.
because of the realizations that how ambulance is actually or emergency medical services is actually available across Indonesia. Probably we still have problem relating to equality, access, accessibility and stuff. So we realized that it is very important also to kind of like extend or conduct research in the different area. So just an example, we went to another island in Indonesia, Bangka Belitung, and where we did our workshop, and then uh, in one of the journey we went there. I think it is in Bangka Belitung. Uh, on the journey, we saw someone had an accident on the motorbike, and there were no ambulance.
Oh yeah.
No ambulance, and then
Wow,
so
my
lucky,
God.
yeah, so
Yeah.
luckily one of the people in our car was
Yes.
is a nurse paramedic, so she stepped down and helped a little bit.
Mhm.
And also when we went to we went to Malang, so we
Okay.
saw also like accidents, but
Mhm.
obviously ambulance is very difficult, or didn't see any
Mhm.
ambulance, so yeah. So it is for some area of Indonesia, maybe it is difficult to get ambulance, and so that's why people didn't really know where. Even people in Jakarta, they don't always know how to contact ambulance because
Yes.
there were many numbers. I think one is 112,
Yes.
118, 119. So
Confusing.
although
Mhm.
now I don't know, they have one platform. I don't know if you heard Jack Connected. I think there's like a platform how to call ambulance, and I think it's free of charge. It's provided by the government. But I don't know in your area whether it's the same regulations. So yeah, uh, I think it will be very interesting to also conduct such research in
Yes.
your area. Yeah,
Yes. God will.
yeah.
Okay, thank you so much for such addition informations, ladies and gentlemen. We would like once more to invite you. Any one of you who wants to ask? Ada yang mau bertanya, Bapak Ibu? Kalau tidak ada yang mau bertanya,
Boleh, Bu.
oke,
Boleh, Bu.
silakan. Please
Saya mau bertanya
welcome.
dalam bentuk bahasa Indonesia, boleh, Bu?
Boleh,
Boleh.
boleh. Dr. Sari
Eh,
understand Indonesia, right? Yes.
Saya mau bertanya.
Yes,
Terima
yes.
kasih, Bu. Ini pengalaman saya. Nama saya Nunung Rahmansyah, Bu. Saya usia 49 tahun. Kebetulan saya punya adik yang bertugas sebagai paramedik atau tenaga kesehatan di ambulan ya, Bu ya. Bahkan 2 minggu yang lalu saya sempat menggunakan mobil ambulan untuk keluarga saya. Yang saya rasakan, kebetulan saya juga mantan petugas, mantan lah pegawai di dinas kesehatan ya Bu ya. Eh, Bisa saya sampaikan bahwa memang informasi tentang mobil ambulan ini masih sangat terbatas di masyarakat ya Bu ya. Apalagi tidak kita pungkiri sekarang di negara tercinta banyak mungkin partai-partai yang sudah memiliki kendaraan operasional dalam bentuk ambulan. Sehingga sebelum mereka menggunakan ambulan milik pemerintah, cenderung mereka menggunakan ambulan milik partai. Termasuk saya, Bu, ketika kemarin saya harus membawa adik ke gawat daruratan dari Rangkas ke Tangerang, saya lebih cenderung menggunakan mobil ambulan dari partai. Mohon maaf ya, Bu, ya, yang diberikan dari non NGO lah, non government organization. Permasalahannya mungkin masyarakat belum tahu nomornya, itu yang pertama. Kedua, mereka canggung kalau berbicara soal biaya. Itu yang mungkin menjadi permasalahan utama bagaimana selain akses informasi, nomor informasi, terkait pembiayaan juga ini kadang-kadang menjadi kendala. Padahal ketika saya menggunakan jasa dari non NGO itu tersebut, mereka hanya memberikan mengapa itu mah bensin saja dan operasional untuk jalan tol. Sisanya terserah. Jadi dari situ ada muncul nilai-nilai kesosialan, Bu. Nah, kalau kita memiliki dana, boleh lebih lah katakanlah sedikit buat mereka. Tetapi kalau bagi masyarakat yang tidak memiliki dana yang cukup, atas dasar kemanusiaan mereka pun sanggup memberikan pelayanan. Jadi inilah yang mungkin saya rasakan bahwa eh, keterbukaan informasi tentang pelayanan mobil ambulan, tentang yang dilaksanakan oleh pemerintah itu bisa dipublish secara on call, Bu. Karena kalau on call dan dipublish di setiap wilayah, katakanlah di desa-desa, ya Bu, ya, di puskesmas, itu akan menjadi suatu kemudahan tersendiri bagi masyarakat dalam mengakses informasi tersebut. Nah, yang ingin saya tanyakan, Bu, solusi seperti apa lagi ya, Bu, yang harus kita berikan kepada masyarakat supaya ambulan ini bisa bermanfaat bagi kita semua gitu kan. Jadi tidak hanya pada sektor kegawat daruratan, ketika ada home care atau visit on the home itu masyarakat dapat menggunakan fasilitas tersebut. Terima kasih Bu. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much for uh, Pak Nunu ya, who has already given the questions. For Dr. Sari, would you like please to answer the questions?
Ya, thank you. Terima kasih banyak nih, Bapak, pertanyaannya. Sebenarnya saya bukan dari providers ya, tapi saya juga aware apa yang jadi concern uh, di masyarakat bahwa uh, seperti survei juga menemukan bahwa banyak masyarakat yang sebenarnya tidak tahu dan mungkin juga sungkan untuk uh, manggil ambulan. Satu lagi mungkin yang saya lupa bahwa ambulan kadang suka diasosiasikan dengan kondisi yang kurang baik ya. Kalau orang pakai ambulan tuh biasanya kondisinya udah nggak baik gitu ya. Jadi orang kadang-kadang segen gitu Pak panggil ambulan. Di samping juga
Iya, iya.
di samping juga excuse me, biayanya itu tadi seperti Bapak bilang. Kalau kalau di sini ambulans itu memang udah bagian daripada pelayanan kesehatan. Jadi meskipun di negara berkembang seperti ini ambulans free itu pun masih terbatas dalam artian kapasitas dan demand karena di sini banyak tapi ambulannya berbeda-beda. Ada ambulan yang untuk transport saja, jadi ambulannya nggak perlu equipment yang kompleks, yang lengkap, seperti mengangkut studi kasus mertua saya yang udah 85 tahun misalnya perlu ke rumah sakit. Beliau nggak bisa bawa mobil, emang nggak ada mobil misalnya, ya masyarakat seperti itu dapat pelayanan prioritas dari ambulans transportasi. Nah, untuk negara seperti kita, saya bukan expertnya, tapi memang faktor yang terpenting itu funding untuk bisa membuat available
Ya,
ambulans itu yang terpenting dan melatih staf paramedik untuk memiliki nurse untuk di training itu kalau menurut ya yang saya dengar dan kalau tidak salah ya menurut ahlinya nggak cuma cukup untuk sekali kan kadang-kadang ada update ya kan Pak kalau nah itu kan butuh biaya pelatihan, equipment, belum lagi running maintenance ambulansnya. Kalau menurut saya, pertama itu fundingnya dulu. Fundingnya dulu. Ambulans emergency ambulance service bukan annex dalam healthcare provision, bukan cuma sekedar tambahan. Tapi itu satu hal yang sangat penting menjadi bagian integral dari healthcare provisions, penyediaan layanan kesehatan. Emergency medical service itu sebenarnya satu hal yang sangat penting karena bedanya antara orang ditangani tepat waktu dengan tidak ditangani tepat waktu pada hal-hal tertentu itu menyangkut nyawa. Kan kalau di negara maju penelitiannya udah sampai sebegitu ya. Berapa lama ini penanganan lambat sedikit mungkinan bisa mortality rate-nya jadi naik seperti itu. Jadi kalau menurut saya solusi nggak ada yang satu yang jitu, tapi paling tidak dikenali dulu ini penyakitnya di mana situ dulu. Kalau menurut saya sih fundingnya dulu. Kalau sudah ada ambulannya, sudah ada stafnya, baru kita seperti apa namanya informasikan ke masyarakat. We have available free ambulance service for you. You know this is the number you can call if you have any emergency situation, something like that. So jadi memang terkaitnya adalah kalau buat para pembesar di sini, pengambil keputusan yang ngikut di sini, mungkin bisa melihat bagaimana saya bisa mengimprove uh, healthcare system saya di region saya untuk bisa meningkatkan kualitas pelayanan emergency medical service, terutama dari segi ambulan. Jadi ambulans itu bukan eksklusif gitu ya, hanya untuk apa namanya ada di hospital sebagai pelengkap. Tapi ambulan itu memang harus digunakan pada saat tertentu. Dan memang nanti ada laginya. Kalau misalnya kita bilang free of charge, semua orang mau pakai ambulan. Nah, nanti ada screening yang lagi, ada triage-nya lagi. Ya kan? Yang mana medical condition yang memang warrant untuk bisa pakai ambulan. Jadi memang masalahnya nggak bisa diselesaikan cuma satu malam. Atau ini titiknya, fundingnya aja, ya nggak juga. Harus oknumnya, infrastrukturnya harus ada. Jadi banyak, Pak. Tapi memang untuk ke masyarakat yaitu awareness, raising awareness. Kita bisa bilang bahwa we have available free ambulance for you, you know. This is the number you can call, something like that. And don't make a confusion with providing a lot of numbers of call. Sorry, jangan membuat membingungkan masyarakat dengan menyediakan nomor yang banyak. Ini ada nomor ini, nomor ini, nomor ini. Cukup aja satu nomor, gitu ya. Nanti dilihat mau masalahnya apa. Oh ya, ini perlu ambulan. Nanti connect ke ambulan. Di mana lokasinya, mana pos yang terdekat, seperti gitu. I hope I answer your question.
How Bapak what about the answer from Dr. Riz? Bagaimana? Sudah Bapak Nunu, are you still here with us?
Boleh sedikit lagi, Bu?
Oh, iya. Masih ada pertanyaan lagi, Bapak? Apa sudah cukup? Tadi sudah terjawab oleh Dr. Riz? Okay, I guess Dr. Nunu is getting freeze, yeah. Ladies and gentlemen, thank you so much for Dr. Riz for your valuable answer, yeah, and relate to our situation and condition. And Dr. Nunu, are you still with us? Bapak Nunu bagaimana? Sudah
Yes, I'm
terjawab?
still with.
Okay. There is no more following questions ya, Bapak. Bagaimana? Sudah
Boleh
ya?
satu lagi nggak, Bu?
Oh, you still have one more questions. Bagaimana Ibu Sari? Would you like?
Satu lagi nggak, Bu?
Sure. Yeah,
Boleh
sure.
Oke. Please, Bapak.
satu lagi?
Iya, boleh,
Oh,
boleh, Pak. Boleh. Silahkan.
ya, Bu, mungkin ini tambahan, Bu. Memang ambulan kegawat daruratan itu sangat terbatas ya, Bu ya. Kita juga memaklumi dengan banyaknya kasus yang terjadi sekarang ini. Tentunya kita harus saling memahami, bisa memposisikan kegawat daruratannya seperti apa. Dan alhamdulillahnya mungkin sekarang di kita ya hampir setiap desa kita memiliki mobil siaga lah. Jadi langkah itu tersebut, penyediaan kendaraan tersebut menjadi salah satu opsi yang sudah terjadi di pemerintahan yang dibeli oleh pemerintahan desa sehingga memang Kalau tingkat kegawatan daruratnya sudah kategori merah, mungkin harus menggunakan kendaraan yang dengan spesifikasi yang lebih lengkap dibanding yang kuning atau hijau. Itu mungkin bisa menggunakan mobil desa siaga. Terima kasih Bu ini atas pencerahan buat kami. Ini suatu kesempatan dan kehormatan bagi kami untuk diskusi berbagi pengalaman dan tentunya Ibu memberikan pencerahan kepada kami sebagai masyarakat dalam penggunaan kendaraan ambulan lebih lanjut. Terima kasih Bu. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much also for Bapak Nunul has already given such inspiring questions also ya. Okay, if we have still have limit time, so we'd like ask you to give one more questions ya. Ada yang mau bertanya satu lagi saja?
Pakai bahasa Indonesia aja deh.
Oke, oke. Ada yang mau bertanya? Any one of you? Sepertinya tadi saya melihat ada yang raise hand ya. Nah,
Baik Bu,
bagaimana?
saya izin
Oh,
bertanya Bu.
oke, oke, oke.
Ya, baik. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Izin bertanya terkait bagaimana cara mengatasi jika ada salah satu ambulan memerlukan perubahan rute dikarenakan macet parah atau ada hal lain, sedangkan pasien tersebut dalam kondisi kritis. Ya Bu, baik sekian terima kasih. Wassalamualaikum warahmatullahi wabarakatuh Bu.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much for the questions. Yeah, Doctor, please would you like please to answer? Yeah.
Terima kasih pertanyaannya Pak Zaini ya.
Yeah.
Ya Bu.
Sebenarnya ini pertanyaannya tepat ditanyakan untuk driver
Mm-mm.
ambulans ya.
Yeah.
Ambulans driver
Ya, ya, ya.
atau yang bertugas ya ya ya. Bagus pertanyaannya bagus. Memang kondisi di pelayanan ambulans itu salah satu hal yang terpenting adalah bagaimana sampai ke hospital secepat mungkin gitu ya. Nah, kalau
Ya Bu.
kalau di sini kan jalanannya sepi. Jalannya sepi, nggak ada macet gitu ya. Jadi ya itu tetap juga karena sepi, jauh, sama juga jadi lama juga. Kalau di Jakarta mungkin di daerah yang padat itu masalahnya traffic ya, traffic condition gimana menghindari. Tapi kalau ambulan, saya beberapa kali di Jakarta ngelihat ambulan AGD kita 119 terjebak di macet jalan tol begini, mau alih alih rute pun nggak bisa, orang jangan bisa keluar, gimana? Iya kan? Tapi kalau misalnya kalau saya kurang tahu mekanisme apa yang dipakai di ambulan call center. Kalau di 119 118 dia punya screen besar di head office, dia bisa lihat ambulannya lari kemana-kemana, ambulannya ada di posisi mana. Mungkin saya nggak tahu, mungkin driver akan kontak bisa kasih advice, kemana, hospital mana yang terdekat karena ke sini lebih macet, lebih lama semacam kayak gitu. Mungkin juga mereka pakai Google service, Google App untuk lihat rute tertentu. Google biasanya bagus ya. Kadang-kadang terlalu bagus, bawel dia. Kita mau lewat sini, dia masih bilang enggak, lewat sana aja kan gitu kan. Tapi saya nggak bisa jawab ini dengan jitu karena saya bukan ambulan driver ya Pak. Pak Zaini.
Ayo
Cuma
Bu.
memang
Terima kasih Bu.
iya, heeh. Cuma memang bagus pertanyaannya. Itu nanti jadi salah satu point consideration ya. Kalau Pak Zaini misalnya involved atau beraktivitas di pelayanan ambulans service, itu mungkin jadi salah satu hal yang jadi bahan diskusi yang bagus itu nanti. Ya maaf ya kalau saya nggak bisa jawab.
Ya, ya Bu, terima kasih Bu.
Ya.
Sekian terima kasih Bu. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Izin Bu bertanya,
Sure.
Okay,
boleh?
sure, please. Yeah.
Izin bertanya
Dan
sedikit Bu
Bapak
Iya,
terkait
iya,
Brian.
dengan ya
silakan, silakan.
izin Dr. Bridge dan Ibu Nurul izin bertanya terkait dengan ambulans. Kebetulan saya seorang apoteker, saya farmasis tapi tidak begitu paham juga terkait dengan ambulan. Tapi boleh izin bertanya terkait dengan ambulan. Apakah ada, misalkan kita di kondisi di Kabupaten Lebak ini dengan jumlah penduduknya hampir 1.500.000 orang, dengan puskesmas kurang lebih 44 dan 3 rumah sakit. Kalau tadi untuk menanggulangi krisis kegawatan yang ada di rumah sakit yang tadi sampaikan Pak Nunu, ada eh, mobil siaga dan sekarang ada unit 911 di Kabupaten Lebak. Sebenarnya dengan kondisi jumlah penduduk, apakah bisa menghitung berapa sih jumlah ambulan yang emang dibutuhkan oleh Kabupaten Lebak dengan kondisi jumlah penduduk yang ada 1.500 gitu. Jadi apakah ada metode yang cepat? Oh mungkin seperti ini harus, jadi kita bisa menghitung untuk bisa menanggulangi kegawat darurat yang ada di Kabupaten Lebak. Mungkin itu aja Bu pertanyaannya. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Ini pertanyaannya bagus sekali nih.
Ya.
Ini berkaitan dengan capacity and demand ya. Biasanya gini. Nah, sebelum kita bilang, oh Pak, siapa tadi namanya? Oh,
Brian, Bu.
itu
Brian ya Bu?
Pak siapa? Pak
Pak
Brian.
Brian ya Pak?
Ya.
Dengan Pak siapa
Eh,
Pak Brian Pak?
Pak
Pak
Brian
Brian,
ya.
siap.
Pak Brian. Pak
Iya
Brian ya,
Brian.
sebelum kita jawab, oh Pak Brian, sebenarnya itu ada rasio internasional bilang atau certain country pakai rasio satu ambulan itu 5.000 orang misalnya, atau satu ambulans itu 6.000 atau 50.000 orang. Saya secara pribadi sebaiknya jangan ikut-ikutan semacam segitu sebelum kita lihat kondisi kita. Kalau menurut saya, yang pertama, kalau belum ada data sebelumnya, pelajari dulu sebenarnya demand daerah kita itu seperti apa untuk ambulan. Itu bisa dilihat dari kondisi kesehatan orang yang sakit atau yang sebelumnya data pengguna ambulan bagaimana, semacam kayak gitu. Jadi bisa jadi di daerah Bapak penduduknya jutaan, tapi sebenarnya nggak ada yang sakit, gitu kan? Berarti kan ambulannya nggak perlu banyak-banyak. Atau bisa jadi daerah yang penduduknya sedikit, tapi usianya usia tua dan perlu pelayanan, perlu kalau di sini juga ada misalnya ambulans hostnya di farmasi ya, farmasi misalnya untuk ini itu.
kayak terharu gitu, ngerti gak sih? Aku nggak keberatan, nggak bakal keberatan. Aku tahu loh kan saya yang kata kamu ngeliat si Jeffy Adams. Bola aing mah kan ikut sholat duha bae gitu.
Jadi kalau menurut saya untuk bisa tahu berapa rasio yang kita bisa perlukan untuk penyediaan ambulan itu dipelajari dulu demand sebelumnya. Jadi berapa yang dari tahun-tahun lepas kebutuhan akan emergency ambulans, bukan sekedar orang perlu transport. Karena mungkin kondisi kita di negara kita belum waktunya kali ya kalau untuk laser transport pelayanan kecuali memang benar-benar takutnya nanti semua orang mau perlu ambulans padahal sebenarnya bisa naik mobil sendiri tanpa jeopardize apa namanya kondisi kesehatan dia gitu ya. Kalau menurut saya itu dulu Pak, ini pertanyaan bagus. Nanti mungkin kalau Bapak mau lanjut untuk mau nggak kita seperti adakan semacam studi analisis untuk kebutuhan ambulan di daerah Bapak. Jadi sebelum semerta-merta kita tentukan, oh perlu 10, perlu 5, perlu 8 gitu ya. Kita adakan dulu analisa kebutuhan. Nanti baru kapasitasnya. Itu kalau sudah ada data seperti itu nanti bisa dimodelkan dengan optimalisasi. Misalnya titik-titik mana yang perlu ditaruh ambulans gitu loh untuk bisa meminimalkan jarak ambulans, nanti kan bisa meminimalkan waktu tempuh semacam gitu. Uh, atau bukan cuma di titik di penduduk tapi juga ke arah rumah sakit mana yang harus dituju. Jadi semacam kayak itu tuh banyak sekali nanti metodenya bisa bisa macam-macam. Cuma yang terpenting kalau kita belum tahu apa-apa, lakukan dulu analisa kebutuhan akan emergency ambulan yang di daerah kita. Itu ya Pak ya. Jadi nggak bisa nih saya bilang, Pak, Bapak butuh 2, butuh 3. Saya harap itu menjawab pertanyaan Bapak ya.
Ya, terima kasih Bu Dokter. dokter.
Baik, terima kasih
Sama-sama.
kepada Dr. Sari dan juga Bapak Brian yang sudah memberikan pertanyaannya ya. Eh, Sepertinya ada yang sudah mengangkat tangan ya, Imanuela Berutu.
Iya, Bu,
Imanuela.
iya, Bu, saya ingin
Oh
bertanya.
iya, silahkan jika ingin
Uh,
mengajukan pertanyaan.
can I speak in English?
Oke,
Sure.
sure.
Okay, thank you for the opportunity. I would like to ask a question to Ma'am Sari about sound of ambulance. But
About what? Sorry?
sound of ambulance. But
Sound of
but
ambulance.
first, let me introduce myself.
Mhm.
My name is Manuela, and I'm from the accounting department. The sound of ambulance siren plays a crucial role in signaling emergency situation. However, for some people, it can also trigger anxiety or even trauma, especially for those who have experienced loss or tragic events. This highlights the importance of balancing medical urgency with the physiology well-being of the opportunity. So my question, how can ambulance service mention a balance between the urgent need to use sirens and the sensitive toward individuals who may have trauma experience?
Mm.
Just that my question. Thank you.
Okay, thank you.
Ya, thank
Uh,
you.
Thank you for the questions. Again, yeah, this is relating to the operational of the ambulance. Possibly it is on the road. Yeah, ambulance will not need to use sirens if they don't need it today. I mean, they need it when they have a real emergency patient inside, and they would like to other traffic to give them way. That is the idea, isn't it? Using the siren to let people know, look, there is an emergency situation here. Give me a way so I can pass the road. So that's what it is. But I don't know what is the situation in Indonesia, and particularly Jakarta. Maybe people abuse. Oh sorry, saya pakai bahasa Inggris ya. Nggak apa-apa. Jadi maybe mungkin maybe people abuse how using ambulance, say where there is no real emergency behind. They just want to be quick. It could happen, but I don't know. I don't know the situation. And I think this is a good question as well. The thing is, I cannot answer because I'm not an expert in mental health, where people can get anxiety or traumatized because they hear the siren. And again, if this is the case, I would say probably the ambulance driver wouldn't know that people around them, they have this anxiety because they just do what their duty is. They just need to take the patient to the hospital. This is a very interesting case as well, because I know one director of ambulance service in Indonesia is conducting research on I think competency of ambulance driver. And this is a very good research, I would say, because maybe this is area that Indonesia haven't really looked at, that ambulance drivers need to be properly trained, how they drive. Over here in the UK, everybody who drive, they will have to go through school, as driving school, and they have to have a proper test. They have to sit the exam, and they have to do the test. Everybody, you cannot just say I want to make a license and tomorrow you get it. No, you have to do the test. So everybody who drives have to undergo learning, studying. I don't know what is in Indonesia at the moment, but this is a one. I know that one of the peoples who's in the um, Indonesia, they research on the competency of the ambulance driver. And this is particularly maybe will relate to how the ambulance driver will use the siren, when they use the siren, when they will not use the siren. And also this is going to be relating to the policy, to the yeah, too many things. I would say operational. Yeah. I'm sorry, I cannot answer your question because I'm not the expert in this mental health. And also I'm not like and I don't really understand the situation in Indonesia, but I assume the expert here will know that you have a certain rule when you have to use siren and when you don't have, to use siren and stuff. So yeah, this is another issue. I answered answered your questions, Imanila.
Okay, thank you so much, Dr. Sari.
I'm
Yeah.
sorry, Miss Sorry
Okay.
about my question, but so thank you so much
Fine.
for explanation.
Okay, thank you so much, Emmanuel Bruto. Ladies and gentlemen, I guess we have already closed our sessions for asking and answered. So, ladies and gentlemen, we come to the end of our plenary session. Thank you so much for Dr. Saribris who has given us such inspiring material and bring us to very attractive and insightful discussion. Thank you so much, Dr. Sari. Yes.
Thank
And
you,
this
everybody. Thank you.
doctor remain on screen because we would like to give you a symbolized token of appreciations and certificate. Wait for a moment. Okay. Have you seen this slide? Okay, ladies and gentlemen, please give a warm welcome. Please give a round of applause for Dr. Saribah Nurbriz for the inspiring material about medical service. Okay, thank you so much,
Thank you.
Dr.
Thank you very
Sari.
much.
Yes.
Thank you. Thank you for everyone who listened.
Okay. Okay, ladies and gentlemen, it seems we have reached to the end of the event. Our whole agenda for two plenary sessions also is closing to the edge. But don't forget, we still have a parallel sessions that will be held tomorrow. Please join in and attend the parallel sessions on the Tuesday night, October 2025 at 7:30 a.m. till 4 p.m. Okay, distinguished guests, participants, ladies and gentlemen, on behalf of the organizing committee, would like to extend our sincere gratitude to all speakers for insightful presentations, in addition to everyone for your active participations and presence. Hopefully, today's agenda have been informative and inspiring. We look forward to seeing you again soon. And for the participants, don't forget to have di attendance ya. Jadi untuk para hadirin silahkan untuk mengisi absensi terlebih dahulu. Nanti absensinya akan di-share ya di kolom chat begitu. Sudah di-share ya. Nah, jadi untuk hari ini cukup sekian ya. Terima kasih banyak kepada Dr. Brice. Semoga kita bisa bertemu kembali ya Dr. Brice dalam insightful presentation and material. Saya rasa masih banyak ya ingin bertanya begitu ya Bu ya. Karena materi yang sangat menarik ini karena keterbatasan waktu begitu ya Bu ya. Jadi kami harus mengakhiri plenary sessions yang kedua ini. Dr. Sari also, you have the greeting for our rector ya, Dr. Sari. Ada kiriman salam nih dari
Thank
Pak
you.
Rektor begitu ya, dan juga
Halo.
seluruh organizing committee ya. Nanti mungkin suatu saat Dr. Sari bisa datang ke Latan sama Siro Ibu ya,
Insya
ditunggu
Allah.
kehadirannya.
Insya
We're
Allah.
looking forward for our next cooperations. Well, ladies and gentlemen, we come to the end of our second plenary session. Thank you so much for all your participation. Don't forget to join us for the next day or the second day of our parallel sessions. Ladies and gentlemen, we close our second plenary session. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Wabarakatuh.
Thank you, Miss.
Thank you, Miss. Thank you, Miss. Waalaikumsalam.
Ketemu lagi
Pidato
besok. See you, Miss.
Indonesia Negara Hukum. Assalamualaikum.
Thank you, Miss.
Thank you. Jangan lupa join besok lagi ya. Join besok. Thank you so much.
Love you.
Udah,
Thank you,
pokoknya.
Miss.
Thank you, Miss.
Miss.
Habibillah hemat, lebih cepat di Shopee.